couldn't handle going home every night, seeing the kids in the hospital. Their parents weren't able to be there. I was just like, God, why is this little kid suffering? Why have they done that? They deserve this.
Oh.
It was so much harder for me to process and let go when it was children. I grew up in a home where my mother had sickle cell anemia. She had multiple strokes. So I literally grew up in the hospital. Nurses were like second mothers to me. I would be in the hospital in the morning, after school, and so forth. And they were always there helping with homework, remembering our birthdays, bringing us meals. So I wanted to be that for someone else. So nursing became a calling to me. I went through nursing school and did all my rounds in clinicals. The hardest round for me was pediatric. And I'm like, I can't be an effective nurse if I cannot separate the two.
Hello, welcome. If you are new to the channel, my name is Carleen Cadet Francois. All I do is help you succeed in caregiving. We help people open successful assisted living homes in Florida. We plan events and we bring you dope guest speakers that will come and give you so much value. And I want you to subscribe if you have not, and press the like button. Today we are here with Miss Judith. She is a powerhouse of knowledge. When I tell you she inspires me so much, she has opened so many other opportunities for me. When I met Judith, it was such blessing. And I feel like the universe just connects you with those who you're supposed to be serving with because they make life easier for you. So today, we are blessed to have Miss Judith, and I'm going to let her introduce herself because I don't want to mess it up, okay?
Hi, good morning. My name is Judith Mergilles, and I am a registered nurse over 20 years, and I've been in healthcare about 25 years or so. I've been in healthcare in all different capacities, all different roles. So I'm ready to be here, assist any way that I can, provide resources, encourage, empower. That's what I love to do, to see those in our industry thrive.
Love that. I went to a networking event. I met Miss Judith, and since we've connected, we've glued our energy. I feel like she's my sister from another mother.
Exactly. Even our car conversations, right? We say bye like 5 times and we sit in the car and talk for like 2 hours. Always something
I
to
love
talk
it.
about.
I know. And that's how you know you found someone that you align so much with, and you just can't stop talking. You can't stop talking. You can't stop helping each other. And you just want the best for each other. And you enjoy the conversation so much that whenever we start talking, we can't stop. We just can't stop.
So now, right? Let them into some of our conversations.
Yeah. And you know what? I know there are going to be some things that you guys are going to want to know about. Just drop it in the comment. I'll make sure Judith get to respond to those. And if we need to bring her back, let us know. We'll do that. So Judith, let's talk about some of your experiences. I know you've been a nurse for a very long time. How did you get into the business world? How did you become such a powerhouse of master networker, connecting people to do business together, along with some other things that you do? But how did you transition from being a nurse to being this powerful woman you are today?
Well, I would say nursing has always been something I wanted to do. I grew up in a home where my mother had sickle cell anemia. She had multiple strokes. So I literally grew up in the hospital. So the nurses were like second mothers to me. I would be in the hospital in the morning, after school, and so forth. And they were always there helping with homework, remembering our birthdays, bringing us meals. So I wanted to be that for someone else. So nursing became a calling to me because the nurses in my life made such a powerful difference to me. And I saw what it felt like to have a nurse that wasn't just taking care of the patient, but taking care of the family. So I gravitated to nursing for that reason, because I felt like I could be that for someone else. So I love nursing, but I tell people all the time, it has to be your niche. I got into nursing thinking I want to do pediatrics. I was like, I love babies. I love kids. That's what I want to do. You couldn't tell me anything else. So pediatric was what I went in, my mindset. So when I went through nursing school and then did all my rounds in clinicals, the hardest round for me was pediatrics. I couldn't handle going home every night, seeing the kids in the hospital. Their parents weren't able to be there. I was just like, God, why is this little kid suffering? Why have they done that? They deserve this.
Oh.
It was so much harder for me to process and let go when it was children. And I'm like, I can't be an effective nurse if I cannot separate the two. And so that was very hard for me. But when I did my geriatrics round, I felt at home. I felt in love because I always had an old soul. I'm always hanging out with the adults. You know, when you come from a Caribbean background, they're always saying you not be around adults, but I was always the one around adults, want to hear the stories, want to hear the experiences. And I felt that with my geriatric clients. I just fell in love with geriatrics. And it was a total opposite of the spectrum of what I thought, you know, but God has his ways and he prepared you throughout life for where you need to be. So I got into geriatrics because that's where I felt like I belong, I related, and I was in love with helping my clients at that stage in their life transition, live their life to the fullest over 65 and older. You know, where most people thinking their life was over, I love to dwell in their experience, their knowledge, their stories, and we related so much. And so that's how I got into the love of geriatrics in that aspect. And so I got into the business realm because I became a case manager. And doing case management, my main thing was what's the best thing for my clients? How can I make sure that when they're home is not just the medical part of it, but also making sure they're taken care of all around. They have the best caregivers, they have the best medications, equipment, and so forth. And I found there was a gap between that and what insurance provides. So every time I wanted to do the best for my clients, I would come into a stumbling block where insurance wouldn't cover it. Insurance wouldn't cover the medication, wouldn't cover an aide in the house, wouldn't cover custodial care. And so I just wanted to know more. Why is this not covered? Why are we not taking care of our elderly? Why do they have to suffer for so much? Why do we have such a lag between what is needed? So I decided to go back and get my insurance license just so I can be a better case manager. I wanted to learn more because no one could tell me why this equipment wasn't covered, why they couldn't get this medication, not the doctors, not the social workers, not the case managers. And I was like, there have to be that knowledge out there. So I went and got my license to become a certified agent, but not to sell insurance, but just to be more knowledgeable and bring that piece of wealth with me in my nursing career. And then another door opened. Like I said, God has plans. I was never went in to be an entrepreneur or wanted to own my own business. I was content with being the nurse that I was. And I realized there was a gap there. And the gap wasn't just not being knowledgeable about insurance, but the gap was also that you need someone in insurance that have the compassion as a nurse. You know, so I'm not just selling you a policy because I want to make this money, but I also know when you're using the policy on the other side, the struggles that you come across and how can I bridge those two gaps. And when I sit with someone for a policy, it wasn't just what gives me a bigger commission, what companies I want to align with, but who does your doctor have a contract with? Do they cover your hospital of choice? Is it the pharmacy that's closest to your home? Because when you're speaking with the elderly, they don't go outside a certain radius. You know, they're going to Publix, you know, and they're going to bingo and come home. You know, there's just certain things that they do, and you want to make sure they remain comfortable. So I put all that into place. I treat my insurance like it's management case, like we go through all the aspects before I sell a policy. So I started off just doing policies for my clients only, because I say, I know why this is not being done, because you're not insured properly. So it was just for my clients. And then they started to refer me to their neighbors and to their families and to their churches. And I was just like, okay, God, I see what you're doing. You know, I see what, that's how you know. It called me and not me looking for it. And so when I find myself driving to 5 homes in one day to sell policies because all referral, I was like, I got to open an office because you can't, you know, survive with this forever. And so it's been now since 2012, I've had my insurance brokerage firm and I don't advertise much for it. All my clients are word of mouth. We have a 90% retention rate. And, you know, our book of business is over 3,000. And it's just been all referrals from clients, their families, their friends, and then trusted individuals in the industry that trust that I'm going to take care of their clients the way that they do. So I did that and continued my job as a nurse and ran my insurance agency for 10 years at the same time. So when they say
so amazing,
a lot of people say entrepreneurship gives you freedom. I was working 80 hours. So the freedom.
You didn't get freedom, but you were making a big difference though, because I love how you became a nurse out of seeing what other nurses did for you and your mom. And I feel that is so empowering because it's one thing to look at how much money does a specific industry makes, and then you look for ways that you can couple that with the type of lifestyle you want to make, and then you make the decision of, okay, where is my career path will be. But for you, it was from a personal perspective that they were such a good model that you decided you want to do this for others. And I think that is something that most people lack. And then to see how you transition that into, you try it in one sector, like dealing with the babies, and you realize, okay, maybe this is not for me because I'm too emotional about it. But then you took it to the seniors, and that's where you found your calling, I feel like. Because it's almost like in serving the seniors, and even for me, I love the seniors. I love the stories they can tell. I love the wisdom, priceless, because you couldn't pay somebody to tell you those things, right? The things that they will tell you. And I feel like while dealing with seniors, it made my life better. And it's like, now I feel like I'm so intrigued to that, where I feel like it's necessary for me to be among seniors to continue to get those wisdom in different phases of life. You know, like I asked her, it was about to be my birthday. I asked her, when you were this age, what did you do? What did you wish you do? And the funny thing is, having money is necessary, and they were paying really good money to be at that assisted living, but having more money was never one of those things. It's always like, I wish I would have had children. I wish I would have, you get that a lot too. Isn't
I
that
wish I would have had
amazing?
more children. I get that so many times. I wish I would have had more children, because you have one child. Each of your children are different. Each of them take care of you differently when you get to your age. But then when they look at, all the memories and goodness and everything they got from their children, that's the number one answer I get. I wish I had more children.
And it's ironic because being a mom is hard. You and I know, you're a mom, you're juggling life, business, personal things. And it's the one thing you don't expect to get. Well, our kids are still small. Maybe if we were older, we'd be like, oh, I'm older. Yeah, I can see that. But right now, where we are, we don't expect for people to say those things. And when you get that, it's so inspiring. How do you feel when you get those kind of answers?
Well, when they get into it, depends on in what context I get those type of answers. Sometimes I get someone that their kids are so involved, dote on them. They're calling me every 5 minutes, checking on mom, how things are going. And you see that love and that connection there. And they're like, I wish I had more children. Those are the answers that, makes me feel so good inside. And I want to send pictures for the children, the videos. I'm going to say, I took mom to get her nails done this time. A lot of times I have my clients, we do things outside of just a typical nursing. If they mention something that they're missing, their kids are not here because of holidays or so forth, I'll go out of my way to do the little things that they're used to doing with their children. But on the other side of it, we know it's not always good when it comes to our geriatric clients, because on top of working geriatrics, I worked in a rehab facility that did both short-term and long-term. And I worked there for over 7 years. That was my first job as a nurse. And one nurse, 30 clients, how that workload is and so forth. I also worked hospice for 10 years as a crisis care nurse. And so in that environment, you saw the real dynamics of the family. That's when you saw family that was never around or that was not involved. And then now mom or dad is dying, everyone comes out the woodworks, and then there's fighting, and then you're dealing with the person in their home, their personal setting. So when they tell me at that moment, I wish I had more children, not because they're so in love with the kids they had, because the one they do have is not taking care of them or is not involved in whatever. And they think, if I had just one more, maybe one of my kids would have been there for me, or one of my kids would have been. So it comes in two contexts. It can come in good, it can come in bad. And I tell people, be careful how you treat your children. They choose your nursing home. And I said, again, too, that's how you have to be careful, because now the roles flip for you. I'm in this part of my life right now where I'm in the sandwich generation. So I have my parents that I care for, and then I have my younger children that I care for. So I'm the caretaker for both at that time, stuck right in the middle. Not one job is more important than the other, but then it's a big stressor on you. That's another reason why we need some of the resources that you have to help the sender generation. Those that take on that role, not only take it on, but they thrive from it, because they feel like this is my turn now to give my parents the life that they've been trying to give me, and to make sure that the rest of their life is the best part of their life, you know? So that sandwich generation is a huge deal and stuff for me as well. So I'm like, that cycle of working rehab, working hospice, working home care, working crisis care, all that comes together because I meet so many people that is going through all those phases or is in one of those phases and they don't know how to maneuver it. And I'm pretty sure you have clients that are going through all those things as well, because they could be on hospice and still be in assisted living, you know, and they can be in rehab stages and be in assisted living. So it's just like, who's going to help them go through those milestones? Their milestones are different than our children milestones, but it's still their milestones. And we have to look at it as such and respect them where they are in their journey, and don't make it seem like it's less of a struggle than anything else because they live their life. That's kind of my pet peeve when people relate to what I call my seniors, is that they live their life, but they're still living. And we have to remember that.
Yes, they are still living. I feel like this is where the blessing is beyond making money, even though like you are making money, but you're making such a huge difference. You feel like it's almost unfair, you know, to do this and to make money doing it and to gain the wisdom, because there's so much things I didn't know. Like even with, like you said earlier, how you treat your children, because now I know firsthand, one of these days, they're going to be managing my finances. Right? They're going to be picking, you know, my assisted living. They're going to be the one who talks to my doctor and decides on this medication or not. You know, so you might want to be careful, right? And I feel like it's a blessing that we're exposed to it now, because now we can structure them in a way that when it's time for them to speak on our behalf, that they will stand up and do it correctly. And I've also seen, you know, seniors that have children who are not involved in the pain that that brings, you know, and you hope and you pray and you do the best that you can, so that your kids don't do that to you. But that's something you will never know until you're in that situation. So it helps to have multiple. You and I both have a lot of kids. I think we have that covered.
Yeah, I think we have a basketball team between the two of us. But, so one of them has to do right by us, right? At least
one of them has to.
But I find it another thing too is for our seniors, not just our seniors, but prior. We're looking at our age group. Before we get to that senior category, even though I get some senior moments sometimes, but we're not quite there yet. But before we get to that, what can we put in place that we don't have to wait on our children? One of the biggest things I look at is I don't want to be a burden to my kids when I get to that age. You know, we want them to be able to talk on our behalf on certain things, but I have to also remember they're having their own families moving forward. So yes, I want you to check on mom, but if mom can have everything in place, so I'm not a burden. Like I want, when you come to check on mom, when you come to assist mom, is because you want to, not because you have to. So that's why having those things in place is so important. Talking to your children about long-term care insurance. One of the basic insurance that a lot of people do not think about, because by the time you need it, you don't get it anymore. You know, it's just like you can't get car insurance after you got into a car accident. You no longer qualify for that. You know, the insurance companies are business to make money. So they're not going to write your policy and say, hey, you had an accident yesterday, so let me write your policy to pay for it today. And so when you're looking at long-term care insurance, you look at it at that age where when you're in your 40s, in your 50s, and you look at what can I put aside? We look at life insurance, we look at health insurance, we look at Medicare, especially a lot of our seniors right now have that mentality that I've worked my whole life, I paid into Social Security, they're going to take care of me.
It's not true
at all. They don't know the limitations, that it's not even that Social Security or Medicare don't want to take care of you. If you know how Medicare works, you know certain things they can't do. It's not within the scope of what Medicare pays for. And when you are a senior who is in an assisted living facility, or you might just be at home, or what we call them now, I have a young lady that is one of my networking groups. She is a contractor, and she calls herself the lifestyle contractor, which I think is so great, because what she does is she builds mother-in-law flats in the back of your house. So if you want to live with you, but not quite live with you, they can build that in the back of the house. I don't know how many people are able to do that, but there's so many different ways to go about it. Your assisted living, your independent living, your rehab, your mother-in-law flats, or what we call proofing your home for those that stay with you if you have an aide and so forth. But long-term care insurance can pay for so many of these things. So that way it doesn't come from other funding. And if you get it at the right time, it definitely is not so costly as when you look at the check and balance, how much you're charging per day for an aid, how much it costs someone a day to live in an assisted living facility, and if you have Medicare, certain things are paid for, certain things are not paid for. You have a percentage, and are you going through straight Medicare? Are you going through Medicare Advantage plan? There's so many things that as you start to age, you need to put in place. So whoever is deemed to take care of you in those later years, you prepared yourself. You give them the tool to take care of you properly. We make sure our kids have a college fund. We make sure our kids have a savings account. We make sure, but our parents don't have that. So you can be as prepared as you need to be for your children. You can still get bankrupt from your parents because they don't have the right things in place. They don't have the right insurance. They don't have the right setup. They didn't pay into Social Security the way they were supposed to. They don't know when they should take their retirement. It's just so many things that we need to make sure that part of our financial planning includes, am I going to be taking care of my aging parents? If I'm not, which one of my siblings are? What are we setting up? And that needs to be part of your financial planning as well.
And I feel education is coming from having been an administrator, right? Someone who have those financial conversations when a senior comes to live at the assisted living I used to manage. And coming from seeing how stressful it is when the parent did not do what they were supposed to do, all of those things you mentioned above. And for someone listening right now, and you're like, oh, she said so much. What does this mean? What does that mean? Put your comment and I will make sure that Judith get to answer your questions. But it is so important. I mean, you said so much and you said the things that are so important. For someone listening, you may just let it pass you. No, go back and rewatch what she just said. Because I'm telling you that I used to be an administrator, right? That means I would be the point of contact for the family members, for the children, the senior, their doctors, everyone. So I was the point of contact that communicated with everyone. And when I tell you those things that Judith just mentioned are key. Arguments, children having heart attacks, children being sick because the stress of taking care of their parents in the sandwich generation is too much. And then to know that they have no choice because there's no money to pay for assisted living, or there's no money to even pay for caregivers. When some of those stressors could have been cured by just taking additional steps, necessary steps, long-term care insurance, these different types of insurance that will help your children, because we know different people have different kind of money. Like how Judith mentioned about prepping your children, right? For those of us who have enough money, we've already do that. But for some people watching, you may not have enough money to prep your children, but you can prep yourself. And in turn, you will end up prepping your children because some things they won't have to worry about, like how they're going to pay for your assisted living, giving them a choice to have at least a caregiver, right?
Yeah.
And Judith, do you provide all of those insurances? What would someone need to be able to get some of those insurances that you mentioned besides just the money?
Well, we take a holistic approach to everything. So a lot of times people say, can you quote me? I won't quote someone that I don't have a conversation with. I sit down with you and go through everything, not just financial. Health takes a big portion of that because depending on where you are health-wise, when was the last time you've been hospitalized? What's some of the diagnoses that you have? What medications that you're on? You might not qualify for long-term care insurance. That's why I said the sooner the better. Just like with life insurance, the younger you get it, the less the price and the better for you. Same thing with the long-term care. So long-term care can be expensive or you can't get a standalone long-term care insurance. But there's other options where you can get it as a rider to your life insurance. Some people are like, I don't need life insurance because when I die, I die, you know, who am I living it for, and so forth. But then there's other riders you can add to that, where you can have living benefits within that life insurance policy, where you can pull from that to do what you need to do. But you can have a rider for long-term care. God forbid you need to use your long-term care portion before you use the life insurance portion. You can do that as well. But some of us, again, growing up where we're generation a lot of things, entrepreneurship, first generation college graduates, and so forth, we might not have the funding to do certain things. So understanding some of the other resources that's there for you. How do I qualify for Medicaid? You know, first of all, what makes me qualify for Medicare? At what age do I qualify? I might not have reached the age yet, but I have a diagnosis that deemed me qualified for that. So therefore, I can get whatever it is that Medicare provides. Why should I get Medicare through that route or this route? That can pay for some of the resources we're looking at. But also, too, the advantage of having Medicaid as a secondary, being a dual enrollment client that has Medicare and Medicaid, there's another reach that Medicaid has that Medicare do not have. We know how we have Medicaid case management programs that helps to pay for assisted living and some of the other things that Medicare does not cover. And what makes me qualify for that? How do I sign up for that? What does that entail? How do I get with a case manager? Because you might sit with me and you don't qualify for long-term care insurance, or you can't afford a long-term care insurance. But I want to give you the other resources, because always a way. We just have to sit with the right people. So a lot of times, I tell people, it might not be the same route for everyone. Our circumstances are different. And I would hate to put you in a situation where you would pay for a policy for a year and then have to cancel it because you can't afford it. If you can't pay for it for a certain amount of time, let's find a different route. Let's find a different avenue. We have our clients. I have a lot of clients that are veterans. The VA has programs as well that assist with long-term care. That's not your typical, VA medical programs, but you have your aid and attendance programs. So there's so many different avenues. So depending on where you are in your life, what your experience, what your category you fall under, that would better help me guide you through that process. And I don't just work with me because I specialize in one thing, but I work with a lot of other agents that specialize in certain areas. If I go sit with you and I'm like, what you need, I'm going to connect you with the right agent. That's their specialty. Because we want to make sure no stone goes unturned. I'm not going to sell your policy. I want you to make sure that you are prepared for the future.
And you know what? That's when your heart comes in, because you're looking at the client like how you would want to be treated. Even beyond that, you go above and making sure if you don't provide this service, here's the person who can help you with that. If you don't qualify for this particular insurance, here's your secondary options. And I feel like along the way, you are educating them as well, because you're not saying, oh, let's go down this checklist. And then if they don't meet the requirement, you simply tell them no. But you really look for ways to really help them and make them feel helped. Because sometimes we can claim we help people, but in reality, did they really walk away feeling helped? And I know even beyond all of your great insurance knowledge, you also have knowledge about nursing registry. Can you tell us a little bit about that?
Yes. So coming from working as an assisted living and rehab, I decided to kind of pivot into the home health aspect of nursing, because at that point in time, my main reason for going that route is I had a lot of clients coming in and out of the rehab. I was a rehab nurse. They would come in either after surgery or post-fall, stroke, heart attack, whatever it may be, and they rehab at our facility. Then we send them home. Once we send them home with their orders or everything else, then they will come back in 2 weeks or come back in a month or come back. It was a revolving door. My clients were constantly coming back with another injury, another medical issue, another negligence in certain things. And so it piqued my interest as to why am I getting the same clients coming back over again? After I know we rehab them, I educated them, we provide them the resources, what's going on. And then I started doing home visits because I wanted to know what is going on in the home that we can't catch this before they come back into the rehab. And I always say that doctors, insurance companies, also, they should concentrate more on preventative, therefore you prevent them. It saves you the cost of having to rehab them. What can we put in place for them to prevent the falls, prevent the lack of medications, the resources, and so forth. And so when I was going through that process, I started doing home health visits. So I started off as a home health visit nurse, just visiting and checking on clients, where they are they going through their plan of care, they have everything done the way they're supposed to do it, and so forth. So after I went through all that, I realized, hey, the reason that we're having this turnaround, because once we send them home, they're not following our orders. They're not going through the things that we said that we're supposed to be going through or whatever. They're not following the orders or whatnot. So that's the reason why they keep falling. They keep doing all the things. And so I started off just doing that. And then I started doing admissions nurse, same home health setting. So when they come home, I go in and do the initial assessment and put together a care plan for them. These are the things I need you to do so that you don't end up back in the hospital. I need you to have a nurse come in at certain times. I need you to do this on this time and certain things like that. So that started off for like a year or two. And then I started doing my case management, which I would come in and do medications, IVs, and medication management. Because a lot of clients you come in, they have like 20 different pills that they're taking. They don't know when to take them. They're taking pills at the same time that counteract each other. Certain pills are better taken in the morning, certain on an empty stomach. Certain pills are better taken with food or meals. Certain pills are better taken together because they complement. Some of them cancel out each other. But when you give a senior citizen 20 pills to take with no instructions, and on top of that, you have 3-4 doctors that don't communicate with each other, so they're given conflicting medications, and then they want to go to 4 different pharmacies because the antibiotics is cheaper at Publix, but my blood pressure medication is cheaper there. The pharmacy are not communicating. The doctors are not communicating. And then the client just knows I got to take 20 pills. So let me take them all at once because I won't remember the rest of the day. And so they're not getting better because they're not doing it effectively. So that's where a case manager comes in. In the home, they're able to manage not just the medications, communications with the doctors and so forth. And I found that as a case manager, I learned very quickly that I was not just managing the medical aspect of the client, I was managing their whole life as a case manager. When I walk into a home and my client's power is turned off because they always been a stay-at-home wife and mom for 60 years, and then now their husband passed away, they don't even know where to go to pay the light bill. Not because they don't have it financially, but they've never had to pay the light bill. So they walk in and there's no light bill. So if I came in to do medications, that's no longer first priority. Now I got to figure out how to turn on your light bill. Do you know where your checkbook is? Do you know how to use, so it just becomes a case manager embodies all of that. So I found another passion in nursing. When I started to get burnt out in the rehab setting, going into home health kind of made me fall in love with nursing all over again, because now I felt like, again, I'm making a difference. Now I get to take care of the whole person. I get to see them in their element. I get to help them stay at home as long as they need to. And I worked with the same company throughout that process. So I kind of moved my ranks from a visiting nurse to admissions nurse to case manager. And then with my insurance background, I helped them with getting approval for aid and attendance with the VA, Medicaid waiver program. So I started to see as an insurance specialist. And at the end, I ended up being the director of nursing for this particular agency. And I worked there for 17 years. So, which was, a lot of experience all in one, because so many of the aspects came together. And that's one of the things I feel like one of the biggest difference you can make in a patient's life is when you take care of them in their home setting and their environment. You're able to, and there's things that they can't hide from you at that aspect. Sometimes they feel embarrassed and they'll say certain things, but when you come into the home, you're able to see things, observe things, and put things in perspective and put preventative things in place to make sure that they're getting the quality that they need. So running a home health agency, I think brought me the most experience, because it not only allowed me to see so many things, but I had to use everything I've learned in nursing throughout the whole 20 years. I was able to use all of that in that one job title.
I feel like God was preparing you for that particular role, right? Because you couldn't have mapped all of this career path where we would have so much experience in nursing. You try different things in nursing, you see how it works. And then at the end to transition into home health, where you're able to help the whole human being that needs help, regardless of what they need, you feel like you are the connector. You either gonna do for them or you connect them with the people who will do for them, but nonetheless, they're taken care of. And Judith, I mean, we need to have you back because there's so much more I want to ask you. For example, if someone is watching this and you're not necessarily someone with a senior at home, you're not necessarily in the, sandwich generation, but you're someone who is in the process of opening your own assisted living. I mean, everything Judith just talked about, you need to know. How do you implement these things? How do you get those things? How do you know what to do? How do you know how to tell the resident families what they need to do, how they need to do it? You need to have this knowledge. And it's so amazing that Judith will be at the Caregivers Conference, and she is one of our speakers, and you'll get to meet Miss Judith. But if you have a question that you're dying to know the answer to, I want you to drop it in a comment below. And Judith, any last thought for our clients watching?
With the caregiver conference, I would say the tidbit I would give more to those that are either running an assisted living or looking to run an assisted living facility is not just taking this information for the seniors. There's so many other groups that we take care of in our assisted living facility. We take care of children that need lifelong care. We take care of disability, cognitive impairment. All those are your clientele base. So having the resources for that would be something they need to look into. And I'm a big advocate for those that are living in South Florida. One of my titles during my tenure as director of nursing was working with those planning for disaster relief. That's a huge thing that I talk about with, are you prepared when you have residents in your home and then you're facing a disaster? Do you know what your disaster relief plans are going to look like? Do you know what your clients that are deemed able to go into a shelter, and those that need to stay home, and those that need to have refrigerated meds, that needs to be on equipment? And so I find that that was one of the biggest struggles I had working with assisted living, independent living, is that if we go across our yearly hurricane warnings, regardless if we get hit or not, it's a panic. We panic alone as individuals that walk and do a lot of things that we do. We have a terminology in nursing for our easy peasy clients. We call them our walkie-talkies. So our walkie-talkies seem to be a breeze, but when you have clients that need to be in a hospital bed, needs to be on oxygen, needs to have insulin refrigerated, needs to have equipment plugged in. So please, please, please do not bypass the importance of having a completed disaster planning for your clients in that aspect of that form. And also, when you're looking into assisted living, independent living, do not just focus on our elderly, focus on all the other individuals that needs care around the clock, as far as it can be your children, disabled, cognitive impairment. And where do you want to specialize in? And who do you want in your home? And make sure you gear it towards that. Not just, I'm going to fill my beds with any clients that I can get, but truly take the time to specialize in an area. Because if you're going to take on a client cognitive impairment, that's a whole different ball game than someone that needs physical care. Are you prepared? Do you have the right staff? Are you going to be able to give that person that quality of life that they need? So don't just think about the money you're going to make for it. It is very lucrative. You're going to make money regardless.
You just mentioned South Florida. Did you know we are #1 for senior care? Everyone comes to us. We are #1 for senior care. And it's not like Judith is saying, it's not just assisted living. It's those sub-industries at all. Perhaps you're a sprinkler company, right? Yeah. Perhaps you are a contractor who can bring the home up to code for senior living for the sandwich generation children, right? I mean, there's so many other subsections that, because the need is so grave, that those subsections have no choice but to be great staffing agencies. Like Miss Judith have extensive experience in the day-to-day of staffing agencies. Some things we won't get a chance to go over today. Billing, right? I mean, she's a powerhouse when it comes to billing. So we expect to learn so much from Miss Judith. She is a powerhouse of knowledge. And we are super grateful to have you here, Miss Judith. Thank you so much for your time. I so
Thank you.
appreciate your heart. I appreciate how you serve, the way that you serve. And it's one thing to serve someone, it's another thing to go above and beyond, to serve them with such dignity, such heart, level of care. And I'm very grateful to have you here. And yeah, thank you so much for being here,
Thank
Miss
you.
Judith.
Thank you for having me. It was great being here. I'm honored and I'm very excited to be part of the Caregivers Conference. And again, I'm here to help the soft loaded community, whatever resources or knowledge that I have, and I can extend that. And as a partnership, I want us to be able to take care of our community the best that we can and give them the best quality of life.
Perfectly said. Thank you so much, Judith.